Hey everyone, this is Megan.
And Darla. We are your hosts of the Enlighten Benefits podcast.
Our goal is to help you understand all things insurance. In each episode, we will tackle the confusing topics and terminology as it relates to insurance.
We want to create confidence over confusion and make insurance suck less.
We hope you enjoy our show. So now we've talked about Part A, Medicare, Part A and Part B. Now let's dig into Medicare Supplements or Advantage plans.
Okay.
Okay. Now we're getting exciting.
It's just, yes.
Getting hot in here.
It's getting hot.
Okay. So we've talked about, the hospitalization part, Medicare Part A, and you have the $1,400 deductible. And then we have this crazy 20% overage that an individual would have to pay. So this is where Medicare Supplements or Medicare Advantage comes in. You want to jump off and start talking about supplements and how that covers that 20%, what that looks like?
Yes, I would be glad to, Megan.
Well, thank you.
The supplements, you have a couple of different directions that you can go to help with Medicare and those costs. And those two options are Part C, which is most of the time you're going to know it as an Advantage plan.
Right.
And then the other side of Medicare that I feel like what I've seen in my career is Medicare Supplement. And most people aren't really familiar with that.
Right. And that brings on a whole nother alphabet.
It does. You get so much deeper in the alphabet. You get the F, the G, the L, the M, the N.
Right.
And we
eliminated F. So
we did.
Yeah.
And
F is gone.
I think that's a good thing because when I was talking to educators and I told them that they wanted the F plan, they were really disappointed in that.
Yeah.
So glad the F plan is gone.
I don't know that we have time to talk about like each one of them, right? Like the G, the L, the M, the N. You want to just talk about G and then...
I think so. Good idea. Because it can really be really confusing.
Super confusing. But just know, I think for our audience, it's just important to know that there are a myriad of supplemental options that are out there, each one of them having a different price point, right? That's fair?
I would say that's fair. And I think it would be... at this point would be a good time to say that we've all heard our whole life, you get what you pay for.
True. Great point.
So if you pay less in premium, you're going to have more out of pocket.
Right.
So you're going to pay. It's just a matter of who you're going to pay.
And when.
Mm-hmm. So definitely, I say you're exactly right. The G was the one that is the most comprehensive now. Yes. It was F. And I think it's important to say that the only difference between an F plan and a G plan is the Part B deductible.
Right. Which is $233.
$233.
That's what we're talking about. And that's per year. So $233 difference per year.
Yes.
The F is gone. The G has taken its place.
Yes.
Okay.
Yes. And if you're on an F plan, might be a good idea to look and see if you're healthy and you can answer medical questions. Might be a great time because I know those F plans, since they're closed and they're not being offered anymore, if you're on Medicare, you've probably been seeing some pretty hefty rate increases.
Right.
So might be a good idea to get with us and just see if you can get on a G plan. Mm-hmm. And you could save a lot of money that way.
Right. Could definitely help your premium.
Oh, yeah.
So the things, and I definitely want us to talk about the difference between supplements and Advantage. So like we said, we're jumping into supplement plans. But the thing that we like about supplements is you don't have a network. And the thing I find that our clients that are used to being on a traditional PPO plan, like if they were working or if they were an educator and they're used to being on a typical PPO plan, the supplement is the direction that they want to go. They're not used to having someone, especially an insurance company, tell them who they can and can't see, what doctors they can and can't visit, what hospital networks they have to stay in. I mean, do you find the same thing to be true, or do you find something different in practice?
Oh, hands down. I think Advantage plans are very powerful. You're going to see all the commercials on TV. You're going to see all the celebrities. You're going to hear zero premium.
Right.
I mean, they're always trying to get your attention.
Right.
And whenever I tell a client that when you go on an Advantage or Part C, that actually takes over your Medicare.
Right.
Big scary point for me, because if that tells me that an insurance company owns my care, my health care.
Right.
So strict HMO.
Yes.
And so you, I mean, I'm sure you know, Megan, that when you retire, you're going to want to travel.
Right.
You're going to want to take that Alaskan cruise. You're going to want to, jump on a beach somewhere.
Right.
That's retirement. That's what we think. And if you're on an Advantage plan, not that you can't seek help for loss of life or limb if you're on that vacation, but you're going to need to be in coordination with the hospital and your insurance company at every turn, letting them know where you are, what happened, why you went to that facility. You're always going to have to answer to that big insurance company.
Right.
And on a supplement, a supplement is supplementing Medicare. So Medicare stays in charge. It's your primary. And then your supplement would be your secondary to pick up all your extra charges. But you're exactly right. It is complete freedom from any network, any hospital, any doctor in any state, because Medicare is nationwide, right?
Right.
So if Medicare is your primary, then it doesn't matter what state or what hospital you seek care. And a lot of times you have people that have major issues going on. It could be a valve replacement in your heart. It could be major stage 4 cancer. It could be, who wants to be stuck in a network at that point?
Right.
If it's your loved one, if the best doctor is MD Anderson or the best doctor is in Chicago, you're going to want to get your loved one to that facility in that place. And if you're on an Advantage plan, unfortunately, you won't be able to do that.
Right. So with the Medicare supplement, and again, we're just talking right now specifically about supplement G plan, we have no network. We don't even have to declare a primary care physician. Medicare remains in charge, not the insurance company. It does work in any state. You don't have to have any referrals. And you don't have any copays. So basically, you are only going to pay that first $233 per year, and then you're done. Yes. Yeah, it's crazy.
It almost sounds unbelievable.
Right.
When you tell people that are coming from a workforce that has a $5,000 deductible, right. You let them know. I feel like I almost have to say it like 3 or 4 times. Do you agree? Like you have to just keep saying 230. But what else am I paying?
Right.
So I always just use the example of you go and have your knee replacement or your hip replacement or cataract. I found out cataract surgery was like $1,500.
Really?
And I told a guy the other day, I was like, $233. Mm-hmm. You're done. So, if you had that open heart surgery or you had cancer or you had just something as minor as cataracts removed, if it's a $50,000 medical bill, you're only going to pay $233.
Yep.
And it does sound like it's too good to be true.
Right. Yep. So you don't have to pay. The other thing is people will say, well, what's my max out of pocket? No, that is $233 is your max out of pocket.
Exactly.
Well, and we also need to repeat the fact that we are recording this podcast, this conversation, now they change all the time, right? So deductibles, co-insurances, max out of pocket, all of that changes.
Yes.
So we just need to be mindful of that. But today, that deductible and max out of pocket is $233. The other question, just real quickly, that I get a lot is, about a supplement is, gosh, should I choose Blue Cross for my Part G or, for my supplement plan, or should I choose Mutual of Omaha? I've always had United Healthcare. Should I stick with United Healthcare? And I know I've heard you say this, and I say it all the time. All Part G Medicare supplements are all created equal. So it doesn't matter if you choose to go, meaning that they're going to pay the same. Now they can charge whatever they want, right? And so we need to be very mindful of that. But whether you choose, United Healthcare because you've always had United Healthcare insurance, or if you choose Blue Cross because you feel comfortable with Blue Cross, they are all going to pay the same.
Oh, exactly. And one of my little quirky stories that I tell to kind of paint that picture, because I think a lot of times our clients are very visual. And I always, try to put it in layman's terms. And I say, okay, if you are going to buy a Chevy pickup,
right,
and you have printed it off the internet, every little detail of what you want, and then you take that detailed sheet to 5 different Chevy dealers, they're all going to give you a price.
Right.
But at the end of the day, it's still the same Chevy truck.
Right. Exactly.
It's just, what did you pay and whose name is on your bumper? Right. So you could say whose name is on your bumper or whose name is on your card.
Right.
So it's all the same. Yep. They all pay the same. Now, I will tell you the one little thing that a lady came back with one time with me. There is this thing called silver sneakers.
Yep.
Where they pay for a gym membership, and it's tied to United Healthcare. So she was letting me know that with United Healthcare, they pay for her gym membership.
Perfect. But I think your statement's still true that a G plan for your medical coverage it's all going to pay the same.
Absolutely. It's just with United Healthcare, the only little added benefit they give is they are endorsed by AARP.
True. So you do have to have an AARP membership that comes along with that. And you do pay for that.
Yes. So. And that gives you your silver sneakers.
Perfect.
So it's not part of the G plan. It's part of the membership with the AARP.
Gotcha. That could be a little confusing. So now do you think we covered supplements good? We need to jump over?
I think that's good.
So one other thing I wanted to mention is, in order to get the price, this is a little confusing, to get the price for a supplement, because that is an out-of-pocket expense. You pay every single month for the premium for your supplemental plan.
Yes.
Those are based upon male and female, whether you're male or female. It's also based upon your zip code and if you're a smoker or a non-smoker. So it's really important, consumers, to get with someone who is either a broker or works specifically for, if you wanted to go with Blue Cross, it's important to get with a representative to find out exactly what your cost is, because your cost is probably not going to be the same cost as your girlfriend who lives in a different state. Right?
True.
Yeah.
True. I agree. Now, when you have to be careful. I'm just going to touch on what you said. You have to be careful. You know that whenever you call Blue Cross and Blue Shield, you're only going to get the price for Blue Cross and Blue Shield.
Perfect point. Yep.
So when you mentioned get with a broker, I think that's huge, Megan, because a broker is not tied to one specific company.
Right.
So if I work for Blue Cross and Blue Shield, and I sit and have a interview with you, I'm only going to pull out Blue Cross material.
Right.
And so very important, if you're dealing with a broker, then they have all different companies that they work with, so they can actually, we work for our clients.
Right.
We don't work for Blue Cross.
Right.
So we're like travel agents, wouldn't you say?
Yeah.
I mean,
yeah. I've had, you and I subscribe to an actuarial website that helps us determine, we can put into the computer the person's date of birth and, their zip code, and it helps us determine which supplemental plan is best for them. And then I know for me, I will only write supplements that have an A+ rated determination.
Absolutely.
So I'll have 30 options for the client that, most of the time I will not sell them or convince them that to choose the cheapest, because typically the cheapest is going